Hi everyone, Dr. David Cullah here with Synergy Wellness. We have a post-discectomy case here who still has sciatica, sciatic nerve pain down the leg, or what some would just refer to as leg pain. It's called sciatica in most cases. And it goes past the knee and really bad when it gets flared up for her. So we did cold laser therapy to start with, and now we're doing the gold standard Cox Flexion distraction technique. This technique, and you can see the scar right here. Again, microdiscectomy is probably the least invasive of the surgeries where they cut you open and go in, right? Whereas an epidural is also surgery. It's considered surgery. Obviously an epidural or a cortisone shot would be less invasive. Then I would say a microdiscectomy would be next. And then you're starting to get into more serious back surgeries, and they most often fail. They are most often not effective 5 years or even 10 years later. It gets even worse. So the statistics are not good. That's why I recommend for any post-surgical back case, flexion distraction technique with cold laser therapy. That is hands down the most effective treatment for any kind of pre or post-surgical disc injury. It's a very gentle motion. You can see here, right, Winnie? Yeah, it's really gentle. It's not that kind of typical chiropractic adjustment where you put them on their side and you roll them over and rack them and crack them. And no, although we do that technique, it's not as bad as I just made it sound. But that's not what you want to do. The technique that you want to use for a post-surgical or even a disc case or a spondylolisthesis, there are better chiropractic techniques. And trust me, most chiropractors know many techniques. It's not just one technique that chiropractors know. Chiropractors have a whole handful of techniques that they use. So just ask the doctor if he has a Cox table and if he's certified in Cox technique and if he has cold laser therapy. If you've had failed back surgery, it's worth you trying, because your only other option are injections and other surgical pain management procedures. Be wary of them. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.